Hello, class. Today we're going to be talking about interprofessional collaboration and what that means in healthcare and how it's extremely important in healthcare. So, what is interprofessional collaboration in healthcare? The World Health Organization defines it as multiple health workers from different professional backgrounds that work together with patients, families, caregivers, and communities to deliver the highest quality of care. It ensures that all care team members remain engaged with the patient and with each other. It also requires leaders to put their egos aside for the good of the patient. Hospitals now encourage team-based, patient-centered rounds that include not only the doctor, but the bedside nurse, any specialized physicians, and any other relevant team members from other disciplines. This helps to foster both patient-centered care and the interprofessional collaboration in healthcare. Interprofessional collaboration helps bridge the gap. It also ensures that clinical communication technology is being used. It helps team members stay connected so that they can reach out to physicians, like if they haven't created a note yet in the medical record. Interprofessional collaboration improves patient outcomes. It helps to prevent medication errors. It also improves the patient experience and deliver better patient outcomes. And in the end, all of this can reduce healthcare costs. Interprofessional collaboration also helps hospitals save money by making sure that the workflow isn't redundant and that there aren't operational inefficiencies. It levels the playing field and acknowledges that everyone plays a vital role on the care team. And it builds a sense of community and camaraderie, which helps improve staff relationships, and it also could boost retention and recruitment. My evidence-based change is called the We Care Neuroprotective Pain Program. And in order to implement that in the neonatal intensive care unit, there are quite a few team players that would be helpful in supporting this evidence-based change. So primarily, the patient and families are the most important team players, because without the patient and their families, a lot of the neuroprotective pain management program would not be able to take into effect. The families play a vital role because they're at the bedside, they're doing kangaroo care, maybe holding during a painful procedure, maybe giving a pacifier with sucrose or breast milk swabs, or just because they're at the bedside more than anyone else, they know their baby and they know the signs and symptoms that their baby may display to us when they're in pain or distress. So also, pain champions are a vital component to the neuroprotective pain program. There are going to be nurses that are key pain champions, and they're going to play a vital role since they'll be able to teach about the signs and symptoms of pain, what we may or may not be used to seeing in pain and stress in a neonate, what signs and symptoms to look for that we might not be accustomed to, that might haven't learned in nursing school. And then developmental care champions are also big components to this program, because we're taking into consideration that we want to provide neuroprotective pain management, which is a little different than just pain management. We're taking into consideration the environment, the healthcare workers, the ways that we swaddle infants, the sound, the lights, and keeping families involved. So there's a bunch of components to the program, and developmental care champions need to be involved because they're ultimately understand what types of things we need to do for each stage of life, since we're dealing with 23 weekers up until full term and plus. And then our child life specialists. They're the ones that have certain things that the babies can go in that are developmentally appropriate for each age of development. So 23 weekers might go into little dandelions or dandyroos. They need bed covers, all sorts of things like that. Occupational therapists also play vital roles because they teach us how to properly swaddle, properly feed the babies, when to feed the babies, how often to do care, things like that. And then our social workers. Our social workers are big components to this program as well, because at the end of the day, they're going to be the ones that are helping the families cope, and they're teaching the families about coping with having a neonate in the NICU and what types of things that they could expect or not expect, and how it's a roller coaster of a ride. And also they reach out to them and kind of give them groups and supports so they can not feel so isolated and alone, because having a baby in the NICU sometimes is a process that is weeks and weeks and weeks. So families need to feel supported during this time. So there are many collaboration strategies, and collaboration in healthcare, it doesn't only help the patient and their families, but it's also helped and provided benefits to the healthcare providers because it reduces extra work and increases the job satisfaction. Teamwork is such a valuable component to providing safe and effective medical care to patients and their families. And in order for the We Pain program to work, the team must include the families throughout the process. Because in order to be successful, every person involved in the neonate's care needs to recognize that they have a unique role that is valuable to the evidence-based change. Parents have to stay involved and active at the bedside, which can be difficult because we're talking some babies are there for weeks and weeks on end, and families have to go back to work. They have to earn their money. Hospital bills in the NICU are very expensive. So that gets hard when parents have to go back to work. However, we've done with this program, there'll be something called the We Care rounding. And that is when the team rounds on the infant in the morning or at night, we make sure that the parents, if they're not at the bedside, they get a phone call so they can still participate in rounds and they can still be active participants in what's going on in the baby's care. Bedside nurses also play vital roles, and they ensure that the proper steps are being taken to maintain that neuroprotective environment. And then they ensure that the providers continue to follow the guidelines that are set in place under the We Care Neuroprotective Pain Program, such as quiet hours. Providers often forget that we clustered care in the NICU, so they might be free at a certain time. However, that baby might have been poked and prodded and bothered for hours and hours, and now it's going to have the We Care quiet hours. So that means if a provider needs to come back and assess the baby, if the baby is stable, then we would say, the baby will be due at 8 p.m. So no, we're not going to touch the baby for another 2 hours so that that baby can rest and grow and heal. Because that's been a big problem in our NICU, as we just keep poking and prodding and touching, and babies don't get the rest that they need. So education for the providers is a big strategy for us to work together. And because we're coming up with the We Care quiet hours, the We Care pain program, the We Care rounding cards, providers will constantly be reminded that we are continuing to maintain the We Care neuroprotective pain program. And like I mentioned before, clustered care, frequent pain assessments, the quiet hours, involving patients and families in the care, making sure that families talk about the pain management strategies that they are aware of. And if they have any questions or concerns about what's going on with their neonate, to come forward and tell the nurses at the bedside so that we can make sure we're really paying attention to what the neonate's saying. A big component is interprofessional learning activities. So we're learning about the We Care pain program. That will help ensure that trust is built. We all have confidence in the program. And then recognizing that each person has a unique and important role. And then to be able to measure them, there will be tools, surveys by parents, pain score systems, behavioral assessment scales, and neurobehavioral scales that will help measure those outcomes so that infants can have stable regulation systems, reduced pain and stress, and that staff and family are working together to create that healing environment. And then additionally, there are communication strategies. Engaged listening is very necessary for effective communication. You need to actively hear and try to understand and ask questions so that the information is understood. It's one thing to just listen, but to really hear someone speak is more important with your communication. Using proper body language helps also convey an openness. Staying relaxed and approachable so that team members feel comfortable in approaching you. Not wasting someone's time. Being concise and mindful of the shared meaning. Staying focused and conveying just the relevant information will set the tone and help the team achieve that common goal. Being pleasant, smiling, nodding, making sure your tone is approachable and appropriate. You want to speak with confidence. Empathy is huge. You want to maintain empathy because it allows you to take the perspective of another person, and it helps another person to understand what you're feeling. You don't always have to agree, but you should understand where others are coming from, or at least try to understand. And you want to remain open to others' opinions. It's important to keep in mind how you give and how you receive feedback. It can affect the teams, so you want to make sure to have a handle on the differences within the group, because that will frame the questions and the feedback. If people don't feel like you're approachable or provide feedback or give feedback or receive feedback well, then it's not going to work. And so you want to make sure that everybody who's involved feels secure and heard. And so that's all I have on interprofessional collaboration strategies. I hope you like this presentation.